Hi, everyone, and welcome to the podcast. We're so happy to be speaking with Dr. Lorenc today. Dr. Lorenc is a world-renowned aesthetic dermatologist and plastic surgeon who balances surgical expertise with an acute aesthetic sense of composition and proportion in the areas of facial rejuvenation, breast enhancement, and body contouring. Since establishing his private Park Avenue practice, Lorenc Aesthetic Plastic Surgery, he has been actively involved in research, development, and advancement of new aesthetic surgical and non-surgical techniques and procedures. Welcome, Dr. Lorenc. It's so nice to have you with us today.
Thank you.
I'd like to start by asking, why is a mastery of facial anatomy principles non-negotiable for cosmetic dermatologists who offer soft tissue fillers?
Well, I have to tell you, you cannot argue with anatomy. You have to know anatomy. And it's all about safety. And it's all about patient safety. And unless you know the anatomy, you don't know where or how to inject the filler. And it's probably the most critical aspect of the whole procedure as far as keeping the patient safe. So it prevents or minimizes the possibility of complications. So anatomy is key.
Well, that makes total sense. No doctor wants any complications, correct?
Absolutely. And I think that that's really the most important aspect of knowing how to properly inject fillers, know your anatomy.
Mm-hmm. Can you please explain the basic differences between facial fillers and neurotoxins and how to use both injectables in the same patient successfully?
So these are two major classes of what we do in our practices. So fillers are essentially products, typically hyaluronic gels, but there are other products, calcium hydroxyapatite, PMMA, PLLA, many different forms of fillers. And these are agents that fill a depression or add volume. For instance, PLLA in the midface creates volume. So it's anything that adds volume is a filler. On the other hand, a neurotoxin, and there are 4 toxins that are cleared in the US right now, is a paralyzing agent. Basically, it's an agent that minimizes or prevents the transmission at the neuromuscular junction. So for instance, where a muscle contracts, you can block that nerve impulse that goes into the muscle to minimize or weaken the contraction of the muscle. And that's treated to treat what we call dynamic lines or dynamic wrinkles, versus fillers I use to add volume. And you certainly use it at the same time. Routinely in my practice, I will use a filler and a toxin at the same time. They treat different things, but they are certainly complementary.
Okay, makes sense. So it's a case-by-case basis, of course.
Yes.
Okay. So you'll be leading the intensive Hands-On Cadaver Workshop at the 2022 South Beach Symposium. Can you please explain what attendees will experience during this comprehensive training and how the skills gained will be actionable in their practices?
Well, this is a very comprehensive training, hands-on training with a didactic lecture, a pro-section, a dissection of cadaver heads, injection of not only fillers and neurotoxins, but also placement of PDO threads and products such as Silhouette Instalift. So the attendees will experience firsthand how the product that you're injecting feels. We will also then dissect the cadavers afterwards, after the injection. The injections or the products are marked with a dye, and then I will lead the dissection to verify the placement. Not only will we do it through a dissection to verify placement of the products, but also I will be using ultrasound to verify placement and the injection technique. This is a very comprehensive course, and it's not only on the head and neck anatomy, but it's also on the anatomy of the hand as well. So attendees who finish this course will be able to incorporate this newly found knowledge and very comprehensive knowledge in their daily practices.
Wow, that is truly amazing. What a time that'll be.
I'm so looking forward to it. That is actually my favorite part of the whole meeting. Now, I'm totally biased because I am an anatomist, and I just think that there's such an important role of anatomy in what we do in aesthetic medicine. And it really is my mission to make sure that everybody knows the anatomy and is able to properly inject fillers and neurotoxins based on the knowledge of anatomy.
Wow. Well, everyone should definitely sign up for that course.
I think so.
So you've pioneered some industry-defining cosmetic techniques and procedures. Can you please explain how these minimally invasive services contribute to patient satisfaction, and if the availability of non-invasive cosmetic technologies has resulted in fewer requests for more invasive surgical procedures?
Well, as I will take the last one first. It's just the opposite, of course, because providing non-invasive or minimally invasive procedures for patients, it expands your practice. And that's exactly what has happened in my practice. My surgical practice or aspect of my practice has never been busier. And I really attribute that to the fact that I am known for minimally invasive and non-invasive procedures, which brings in patients that might not be candidates for minimally invasive procedures, and then they graduate to the surgical procedure. So it's just the opposite. And as far as the devices and the procedures, I have been involved in minimally invasive aesthetic medicine since really 1997, when I obtained my first patent, and that's a suspension device, totally absorbable suspension device that has been used in endoscopic forehead lifts, endoscopic face lifts, endoscopic neck lifts. And based on that particular device as a predicate, many different devices have been developed, completely absorbable devices for elevation of soft tissue. What that has done is minimize the length of the incision, the time for recovery, and really even the type of anesthesia that's used for the patients. So it benefits the patients ultimately. A lot of my other work has been involved in developing fillers as well. So and as far as fillers, I'm a big fan of fillers, because properly used, those are wonderful it's a wonderful technology that can rejuvenate the face, and not only the face, but the body. We have transitioned to inject biostimulatory agents all over the body, whether it's the décolleté, the dorsum of the hand, or even the upper arms or the legs. So it really benefits the patients without having to go through surgery, but ultimately certain patients become surgical patients. So as I mentioned before, non-invasive or minimally invasive procedures expand your surgical practice.
Okay, thank you for sharing that. Those are some major procedures and wonderful achievements for you.
Thank you.
Of course. So I'm wondering, science is your guide, anatomy is your savior. Can you please explain how this quote on your website exemplifies the cosmetic dermatology specialty, and how you'll infuse the concept into your instruction of the Hands-On Cadaver Workshop this year?
Well, I think that's really an idea that I live by. And what I mean by it is that you have to understand the physiochemical properties of fillers, let's say. You have to really understand the points of differentiation between different classes of fillers and how the fillers behave. And once you understand that, you have to match it with the appropriate anatomical area, for instance. And obviously, knowledge of anatomy is critical to be able to do that. For instance, in the area of the temple, hollowing of the temple, you have to use a filler that has the correct lifting capacity. So it has to be something like calcium hydroxyapatite or PMMA, for instance, where you want a filler that really expands that hollow. On the other hand, anatomically speaking, a very dynamic area, such as the perioral area, let's say the upper lip, obviously you need a much softer filler. So a much softer filler that has a lower G prime, you have to understand the physiochemical properties of these particular fillers in order to choose properly. So again, matching the physiochemical properties, which is science, of the fillers with your knowledge of anatomy. So that's why I live by that saying. And I have to tell you, it does minimize the possibility of a complication.
Very cool. I like that quote, and it makes total sense for your practice and your whole way of life. I'd also like to, yes, I'd also like to ask you, if you could be known for one thing in your medical profession or even personal life, what would that one thing be?
I was asked, that's an interesting question. I was asked that question by a very good friend of mine, who's an extremely well-known dermatologist. And she said to me, Paul, when is it enough? When are your achievements enough? And And it's not about achievements. It's about the intellectual stimulation that I derive from developing new things and new procedures. So the answer is that it's never enough, because I'm always working. My brain is always working. What would I like to be known for is that I've always tried to improve on what we have learned and know and accepted before. And I always want to make it better, whether it's a surgical procedure or a non-invasive procedure. So yeah, I'd like to be known for being the person who always try to make it better and perfect it even more.
Well, I think you all already are known for that. So congratulations. And that's a great answer.
Thank you.
Is there anything else you'd like to share with our audience today?
Well, I'd like to see everyone at Lowe's Hotel in South Beach in August. I'm looking forward to it. It really is one of my favorite meetings of the year. I love the interaction. I like the multidisciplinary approach. There's a great exchange of ideas, and it goes both ways, from the faculty to the attendees and vice versa. I learn every time I go. It's a beautiful venue. And the meeting is really first rate, and I'm looking forward to seeing everyone there in August.
Well, thank you so much. And we're looking very forward to your workshops as well. Thank you so much for speaking with us today. Yes. See you there.
See you there.